Recording is on.
Thank you all for coming on this Monday evening, November 1st. Welcome all, and I'm glad you're here. Luis Marrero, who is our chairman of the Health and Human Services, unfortunately, he lost his mom yesterday. So condolences went out to him. Yes, it's a sad time for him. So he's okay, but it's a little difficult when you lose a parent. I don't care how old you are. I don't care how it's difficult. So we reached out to him, gave him condolences, and that's why he's not here. So hopefully I could fill his shoes, and hopefully if you have any questions I'm able to answer them. um Cynthia, were they able to log on yet?
I don't see them on. I don't see them on at all. But let me check one more time. No, I guess they just give them
Okay.
just give them like another 2 minutes, I guess.
Yeah, well, what we can do is remind everybody that we are working towards trying to do something for the AIDS World Day, which is December 1st. Am I right on that? December 1st?
Yes.
So we're working on doing something like we used to, and hopefully in person. So community board will send out information, and hopefully we'll have a good turnout. So keep a lookout for that. It would be good if most of us show up on that day. Is that for that logged in just now?
Yes.
Oh, okay. So let's welcome our first presenter, and it's from the presenters from the New York Department of Health and Human Hygiene. So if you're on and you could hear us, we're ready for you. Hello, can you hear us?
Oh, I think she had to reboot herself because she couldn't speak. All right, well, I'll make a quick announcement while we're waiting. I sent out a list of everybody's new and current committees. So just take a look at that. I sent it via email.
And for this committee, we got Lynette Olmo, who switched committees. So welcome, Lynette, to Health and Human Services.
Lynette, can you hear us?
She's probably driving. She's probably.
Hi, Cynthia. Can you hear me now? I just said yay, thank you. I'm happy. I'm excited about this.
Okay, I do hear you actually.
Okay. Hi, Ralph, and hi, Julia.
Hi, how are you?
Hola,
Good, I'm
Lynette.
driving, so I'm on mute.
It's okay. Thank you for joining us, and drive safely.
Be careful, Lynette, okay? We'll talk and you listen. Cunningham, are you there?
You have to unmute your.
I'm here.
We hear you.
You hear me?
Yes.
Okay.
Welcome.
Thank you. I apologize. We didn't get the link until just right now. So are you? Sorry. So I just missed the intro. So are you ready for
Yes,
me now?
we said you were from the Department of Hygiene, and we were just waiting for you to log on. So we have introduced ourselves, and if you like, we can go around and introduce. But we have a few board members, This is the Health and Human Services. The chairman, he is out because he lost his mother yesterday. So I'm filling in for him. I'm also the first vice chair. So welcome to our committee.
Thank you. Thank you, and thank you for allowing us to be on the agenda today.
It's all yours. You can do your presentation.
Okay, great. So I'm Dr. Chinazo Cunningham. I'm the Executive Deputy Commissioner of Mental Hygiene at the Health Department. I'm a physician in internal medicine and addiction medicine. And prior to coming to the Health Department, I worked in the South Bronx for 22 years, focusing on improving care for people who use drugs. So 2020 is really set up to be the deadliest year ever in terms of the overdose epidemic in New York City. So just in the first 9 months of 2020, there were nearly 1,500 overdose deaths, which is about the same as all of 2019. So we know that once the data are complete for all of 2020, it will be the deadliest year ever. We also know that fentanyl is driving this increase in overdose deaths, with over 75% of deaths including fentanyl, involving fentanyl. We also know that overdose deaths there are inequities in terms of the burden based on neighborhoods, and neighborhoods such as the South Bronx, East Harlem, and Central Harlem continue to experience the highest rates of overdose deaths in 2020 and in many years previously. So, you know, during this pandemic, we have done a lot of work to really try and address substance use disorder and overdoses. We've worked closely with syringe services programs and opioid overdose prevention programs, helping them with their telehealth and new platforms to deliver services and keep people engaged. We've also partnered with the state to do methadone delivery systems, and we've made naloxone available, either free over the mail or working with pharmacies and neighborhoods to really provide access to naloxone. You know, the services that the city provides to really address the overdose epidemic is $45 million a year. And more recently, we included campaigns to make fentanyl, to increase fentanyl awareness, to increase distribution of fentanyl test strips, to expand access to the syringe services and harm reduction organizations, expanding their outreach and their drop-in centers, and also making same-day buprenorphine available for people who have opioid use disorder. So as things continue to worsen, we really want to focus on every single evidence-based approach and strategy possible to address the worsening overdose epidemic. And to that end, New York City supports the authorization and operation of overdose prevention centers to save lives. So overdose prevention centers are clinical, hygienic places where people can use drugs under the supervision of professionals. The programs are, you know, have been in existence around the world for 30 years and in over 10 countries. These programs improve access to healthcare, so they provide a way in which people can then access substance use disorder treatment, mental health treatment, social services, and basic needs. They also address community concerns by decreasing public drug use, by decreasing drug-related crimes and syringe litters. And then, of course, we know that these overdose prevention centers save lives. So in the 30 years that these have been in existence across the world, there has not been a single overdose death in any of them. So we are encouraging the state to approve legislation that would authorize overdose prevention centers, and we're also working with the federal government, really asking the Biden administration for some action here. So that's really why I'm here, is to talk about all of the sort of strategies that we've put in place and the strategies that we think also need to be put in place, all evidence-based, to really address the worsening overdose epidemic. And I'm happy to take questions.
Thank you so much. I have a couple of questions, and then I'll open it up. You're saying 2020 is shaping up to be the deadliest year. Would you correlate that with the pandemic that we're still going through? Would it be correlated with that?
Absolutely. I mean, there are many reasons why we think the pandemic has worsened, the overdose epidemic. So, for example, there was a period of time in which treatment for substance use disorder was interrupted or limited. We know that harm reduction organizations also had to close for a period of time and then also had limited capacity. People were isolated, right? So they were in isolation hotels or quarantining. And we know that when people use drugs alone, if they do overdose, there's no one there to give them life-saving medication, naloxone. There's nobody there to call 911. There was also changes in the drug market during the pandemic. So there are many reasons why we would see worsening. And part of this certainly has to do with the pandemic.
And my other question is age group. Do you have a specific age group that you have seen an increase in the use of fentanyl or any other drug? And why will you think that age group has increased in numbers?
Yeah, so we can definitely send you the specific data in terms of the age groups. The ages that tend to be that's the most affected is those between 35 and 85. So it's a little bit of the older group, but we have the breakdown by race and ethnicity and age that we can definitely provide those details.
That would be great. And also, we're in a community, of course, the Longwood section, the South Bronx, and we're oversaturated with programs, and that's a concern, because we're growing in the population with seniors, which seems to be part of the age group you gave me, but we're growing with senior programs and a lot of the programs for the younger generation too. But we seem to be oversaturated with programs. Every time we turn around, somebody is trying to bring a program in. So that's something that we would further discuss.
Yeah, I mean, I definitely hear you. I would also just say that in general, in the health department, we use our data to make sure that we know the areas that are hardest hit, and then make sure that their services are available in those areas. And we do know, for example, that Hunts Point is an area that has been hard hit for several years in terms of has the highest overdose death rate of all of New York City.
Okay, does anybody else have any other questions for Dr. Cunningham?
Yes. Hi, my name is Shatoria. I'm a counselor in substance abuse outpatient treatment center. And you stated that it's going to be a center, right, for overdose. So are the clients or the participants, are they going to be allowed? Is this what you said, that they're going to be allowed to utilize substances inside of the center?
Yeah, so in general, the way that overdose prevention centers work around the world is that people bring in their drugs that are pre-obtained into the sites and then use them with supervision so that they don't overdose and die. So typically these overdose prevention centers are also located in areas that have a lot of services. So they have services, so people can have clean needles. They often have services for drug treatment or for social services or for mental health services. So if this is something we were to do in New York City, we would think about making sure that people have these sites would be in places that have other services so that people could link to services. And we do know that the data show that that is what happens, that people who do use overdose prevention centers are more likely to link to those services and link to primary care and link to drug treatment.
Okay. it just seems as though it's a bit counterproductive, and it seemed like there'd be like adverse impacts, because to point someone to treatment centers, right, where they can get services to become abstinent, but also offer them, I guess, a safe space in order to use the substances. Where as far as a lot of the clients that are serviced inside of the South Bronx, they are either mandated by ACS or they're mandated by parole or federal probation, and the intent is that they can't use at all, right? Or if they're in supportive housing, is how can they, grow and become abstinent, especially if they're being allowed to partake inside of these substances.
Yeah, I mean, I think that that's a good point, and one that I hear people, say that it does seem sort of counterintuitive. So, I would start out by saying that people are dying, right? And we need to do every single thing we can do to keep people alive. And we need to use every single evidence-based strategy. We know that overdose prevention centers reduce death. This is what we know from across the world. And so what I would also say is that often, not everybody's ready to enter treatment, right? And so offering services to people, ones that they're willing to, participate in a dignified, way that's clean and clinical and supervised by professionals, and building trusting relationships so that when people are ready to enter treatment, that it's easy for them to sort of walk upstairs or walk down the hall to where drug treatment is offered. And so so that's the way that that I would think about it. That is supported by with the data and the research show, and that's also how sort of overdose prevention centers are sort of organized and situated around the world.
Okay, thank you.
Madam Chair, I have two questions. Hello? Hello?
I see she's on, but I don't know if she got booted off.
I'm here.
No, Julia.
Oh, I have two questions, doctor, for you.
Sure.
First question is, you said you worked in the South Bronx. Where exactly did you work at?
On East 161st Street, near Park, at Montefiore, there's a community health center.
Oh, for Montefiore?
Yeah, one of the federally qualified health centers. Yes, for 22 years.
I know exactly where that is. That's over there by Cortland.
Yeah.
Okay, great. My second question is regarding, forgive me if I'm pronouncing it wrong. So Suboxone? Is it Suboxone?
Yes.
I think Suboxone is the way to go. I think evidence-based, it shows that it gets people off of any opioids. And I think that's the direction we should be going into. We have a lot of these substance abuse programs that, especially like methadone clinics in particular, where we're not seeing the results. You have people on methadone for years and years and years. I really would like to see the city move into the Suboxone. I know it's a state issue also with Oasis, but I just want to go on record for stating that. Thank you, doctor.
Yeah, no, thank you. I mean, so I would just say that, there are 3 FDA-approved medications for the treatment of opioid use disorder. And so one of them is Suboxone, also known as buprenorphine. Then there's methadone and there's naltrexone. And they're all effective in, in people, not dying from overdose. And so, there are many things that the city is doing to expand access to buprenorphine, Suboxone. And so we have programs, and actually when I was at Montefiore there at the clinic on 161st Street, we received funding from the New York City Department of Health to really expand a program so that in primary care, people can get Suboxone treatment. And so that is a program that, that the New York City Department of Health that we fund We also have funding more initiatives as well, working with people who are homeless to also be able to get access to the Suboxone on the same day that they want it. So really trying to reduce barriers so that people can get treatment. And so I agree, we need every tool possible, right, that we know works. Because as I said, this is going to, this is really going to be the deadliest year ever. And we need everything, all the tools that we can possibly use to help people stay alive.
Thank you, doctor. I certainly concur with that. And thank you for your presentation to the board and bringing more knowledge and awareness to this epidemic that we're facing. Thank you.
I have one other question. So, the services, the preventive services that you would have, would it be in the same location as the services that you're going to provide for the clients to be able to utilize the substances?
Yeah, so we're still exploring like the specific details, but that is really, the goal is to locate, if we were to do this, it would be located, within an organization in a location that has a whole range of services, so that it would be one additional service in addition to all the services that, are provided. So services like, clean needles and syringes, like having, Suboxone treatment, like doing HIV testing and hepatitis C testing, having case management for social services, right? Giving showers, food, etc. So like so again, we're still, examining all of the potential options, but that is, really what we're looking at, and that is often across the world how overdose prevention centers are situated.
Okay, and have you guys developed strategies to help prevent those who are in recovery skills, relapse prevention, and behavior modification from going to the other services that you provide, right? Because it can be enticing, and they realistically have cravings.
Right.
Well, so find out that there is a community within inside of the same location that is being allowed to use these substances. They may feel a little bit more enticed, and or they may feel as though their needs are not getting met, or how come they're allowed to do it and we're expected not to do it, because the addictive mind is going to be where it's just, I want this drug and I need it now, and I'm going to tell you why I need it. So
yeah, so I mean, I think you bring up a good point. I think that, so again, we're still, examining all the potential details of, if we were to do this, what it would look like and what other services would be available. But, in addition, the health department does support, for example, in harm reduction organizations like mental health treatment, for exactly what you're saying, is to also help develop strategies for people to, reduce their cravings, reduce their risk of relapse. And then of course, medications, also are very effective in reducing relapse. So the Suboxone, methadone, and often these can be, could be co-located in the same locations. So again, we're still exploring, what the options are and what the details would look like, but there would be, if we were to do this, it would be probably, co-located with a lot of other services, so that people would have options, and many of them are protective in terms of reducing their risk of relapse.
Okay, I just think that's my concern, is that if both of these services are going to be given inside of the same location, I can leave group if I'm using cocaine, and if my drug of choice is cocaine, and I just left recovery skills, I can go down the hall to someone who is able to bring in the drug of my choice into the facility and get it from them. So it's kind of like, how do you, set the two apart where they can basically be able to safely utilize the services without interfering with one another?
Yeah, I mean, I think, those level of details are things that we would, explore. But I do have to say that from the data from these overdose prevention centers around the world, there's no indication that people increase their drug use. In fact, it's the opposite, that people decrease risky drug use and that people are more likely to be linked to treatment.
Okay. Thank you.
Thank you. I have just a couple of follow-ups. You say around the world. Has this been done here in New York?
There has not been an overdose prevention center in the United States. There are 10 countries around the world, and they've been in existence for 30 years.
Okay. Other follow-up is because I know this community very well, and I know the people who attend our meetings, and I know that there's going to be sort of more questions we're having now and more concerns than what we're sharing with. As you would imagine, you know, we're bringing people from other communities to use their drugs in this community. How could we assure or what's put in place, like if they're getting off the 6 train or getting off the 5 train, ensure that their safety, the community resident safety, and the safety around, you know, the clinic. Is there any assurance?
Yeah, I mean, that's a good question. And so I can tell you that there has been research that's looked exactly at this question. And what's been found is that when overdose prevention centers are open, that people, the vast majority of people who use them live within a 10-minute walk from the center instead of, you know, bringing people from outside communities. The other thing that I would also say is, in addition to the fact that it reduces death, it actually has a lot of improvements in the community. So what we know is that there's less public drug use in the areas around, in the neighborhood around an overdose prevention center. We also know that there's less syringe litter, and then there's also less drug-related crime. So, so there's benefits both at the individual level and at the community level.
Thank you. Would you keep us posted as to if plans go ahead and what's the next step and what's in it for our community? So if you could keep us informed of that, please come back.
Absolutely. And, you know, and so this is, you know, informative. I'm talking to a lot of community boards, right, just to really provide the education and let people know about the science, because, you know, there's never been one of these in the United States. So of course people don't know. And so, you know, our role is just to make sure that people understand the facts about the overdose prevention centers and just what they are and what they do and how they're effective.
I'm sorry, somebody else has a question? Lynette, was that you? Okay. Thank you so much for coming in and trying to explain to us, and we look forward to hearing from you again.
Great. Thank you so much for having me.
You're welcome. Cynthia, is our second presenter here yet?
No.
Oh, okay. So any old business?
No, we had our Halloween parade this month. Well, October 23rd, it went really well, and then we linked up with the precinct, and well, we just showed up at the precinct to show support, and they had an event yesterday, and it went really well as well.
I think our events, our special events, they're moving along so wonderful. I mean, it's such great things to see the difference and how good things are moving along. So thank you, Cynthia, and also thank you to V. And if there's anything I can do to help, always let me know.
Yeah.
Any
No, gracias.
Don't forget, we're trying to do AIDS World Day, and we'll send out information on that. That's for December 1st. Anybody else has any news?
Well, we're gonna have our special events November 3rd, which is this Wednesday, and we're gonna talk about other upcoming events. So if anyone's interested, just give the office a call and we'll send you the link. This month was a little tricky because of all of the holidays. We had to move the calendar around. So at least the special events is on its normal date and time, so it won't be too confusing when you guys get the link.
Wonderful. Great work. Thank you. Anybody else, new business? Any announcements? Guys, please don't forget to vote. Tomorrow's election day. For those who have not voted, the early voting, I took advantage of that. But those who have not voted, please go on and vote. Our voices do count. So the election day is tomorrow. And I think the polls close at 9 o'clock. So everybody has time to go and vote.
Okay,
Any
and yes, November 20th is going to be the day that they do the Baldor Community Board 2, the Point food giveaway. So you get a turkey with all of the fixings, but people get there at like 5 in the morning, and it's like for the first, I would say 600, but I can follow up because that's what we're gonna be meeting for this week.
So it's no tickets. It's first come, first serve.
Yes, first come, first serve, and no skipping, because you will be sent to the back. Yes, it's gonna be a little different this year.
Good. We need that. Any other turkey giveaways? I can use a turkey. Any other giveaways? Keep us posted on any other that are announced, okay?
I will.
Thank you. Anybody else with announcements? With that, I take a motion to adjourn.
So moved.
I second that.
Wonderful. Guys, have a wonderful week, and don't forget to give Louis your condolences, okay?
Yes, thank you, Madam Chair. Thank you, everyone. Stay safe.
Thank you.
Thank
Have a good day, guys.
Good
I
night.
got the chat, Ralph.
Right.
Thank you, Sen.